Suicide is a complex problem, and no single approach can solve it. Preventing suicide takes coordinated efforts rooted in data, research, and an understanding of the local context. SPRC's effective suicide prevention model is a blueprint you can use to develop efforts tailored to your situation, which are most likely to create change. The model works for a wide range of settings. You can use it in your community, your state or tribe, health and behavioral health care, schools, workplaces, faith communities, nonprofit organizations, and more. Let's look at each element starting with strategic planning. Suicide prevention efforts are more effective when guided by strategic planning. This is a systematic process that uses data to help you understand the problem, and from there you can set clear goals, select and implement strategies, and evaluate results. Strategic planning helps you determine which of the strategies from the comprehensive approach, which we will look at next, are a good fit to address suicide in your particular setting or community. Preventing suicide needs multiple strategies working in sync. This takes us to the comprehensive approach, which outlines 9 broad strategies to consider during strategic planning, each involving a number of possible activities. These may be programs, policies, practices, or services, and what you choose will depend on what you find during your strategic planning process. The 9 strategies are: identify and assist persons at risk, increase help seeking, ensure access to effective mental health and suicide care and treatment, support safe care transitions and create organizational linkages, respond effectively to individuals in crisis, provide immediate and long-term postvention, reduce access to means of suicide, enhance life skills and resilience, and promote social connectedness and support. The keys to success are 5 main principles that can make prevention efforts more likely to succeed, and the last piece of the model. To make the most of your efforts, incorporate the keys to success throughout the strategic planning process, as well as when implementing the chosen strategies. Suicide prevention efforts are enriched by engaging individuals with lived experience early and often when planning and implementing strategies. People with lived experience have first-hand knowledge of suicidal behavior or are survivors of loss. Partnerships and collaboration make suicide prevention more effective by bringing diverse perspectives into the planning process, coordinating strategy implementation, avoiding duplication of efforts, mobilizing resources, and enabling links between different groups. Safe and effective messaging and reporting makes a difference in encouraging hope and help-seeking, and promoting the message that suicide is preventable and mental illness is treatable. Suicide prevention efforts are more effective if they're culturally competent, that is, respectful of and responsive to groups' beliefs, practices, traditions, and cultural and linguistic needs and preferences. Practicing evidence-based prevention means using the best available research and data throughout the process of planning and implementing suicide prevention efforts. Visit the SPRC website to learn more about these 3 elements of effective prevention and the settings in which they can be applied, or click on the small information icon in the upper right-hand corner of this video to connect to more effective prevention resources on our website.